Welcome and good afternoon. This is Elizabeth Hardig with the American Planning Association. It is just about 12 o'clock and I hear a couple of beeps and folks are still entering the webinar room, so I'll give you a moment to get settled. For those of you who have not joined a Plan4Health peer call, I see a few new names on our list and we're glad to have you, either from the National WIC Association or our colleagues in the Partnering for Health initiative, or I know we also passed along this opportunity to APA's Healthy Community Interest Group, which is great, so welcome. We have our peer calls once a month in both of our focus areas, the Plan4Health focus areas, physical activity or nutrition, and we will record this call and post it on the Plan4Health website. And on the off chance that you haven't checked out our website, I'll go ahead and chat it there. It's a great place with lots of resources about our 35 Plan4Health coalitions working across the country, as well as some wonderful libraries on different topics, chronic disease prevention topics, PSE topics, and of course physical activity and nutrition topics. All right, so it is 12:01. Let's officially get started. And once again, I'm Elizabeth Hardig with the American Planning Association, and we are excited to have Karen Shore from the Food Trust with us this afternoon. So Karen is the Director of Consulting and Technical Assistance at the Food Trust, and she leads the consulting team to help communities and organizations throughout the U.S. benefit from the Food Trust's deep knowledge base and successful innovative programs. Karen has a master's degree in public health, is a mother of 3, and loves gardening and cooking, which seems like the perfect hobbies for a Food Trust employee, so that's fabulous. And Karen's going to start with just a brief introduction to the Food Trust and some resources and her thoughts on what's happening across the country. You're more than welcome to unmute your line and talk directly with Karen, or you can use the chat box on the right-hand side of your screen and ask questions. We would love to hear from you. And of course, we've saved plenty of time at the end of the call for discussion and Q&A and just hearing what's happening wherever you are. So I will hand things over to you, Karen.
Great. Thank you so much, Elizabeth. And hi, everyone. Happy to be on the call again this morning. This is me, putting a face to the name, all the way in the back there. But I'm Karen Shore, and as Elizabeth said, I oversee all of the national consulting and technical assistance work that we do at the Food Trust. And the other hat that I wear, I'm sure that many of you on the call wear a few hats. The other hat that I wear is I oversee all of the work that we do in corner stores and small stores, both locally here in the Philadelphia region, as well as our national programs and partnerships. So working in small stores, rural grocery stores, corner stores, very near and dear to my heart and represents a good amount of the work that we do nationally as well. Just a little bit of background about the Food Trust. So we're a nonprofit organization working nationally to expand access to healthy and affordable food. And we really do that through a variety of program and policy initiatives, but particularly through partnerships with national, state, and local organizations. And really wherever food is sold or served, we aim to provide support or directly implement program and policy initiatives that help provide healthy and affordable options. Like many of us on the call today, we really approach the work that we do with an equity frame, and what this looks like in terms of implementation in the work that we do nationally. We tend not to be seeking to implement the same model or the same set of tools or approaches in different places, but what we're trying to do is achieve the same outcomes. And this really requires a lot of tailoring depending on where we're working, what types of stores we're working in, whether we're working in a rural or an urban community, what the local capacity is of the community or communities in which we're working. But the work ultimately is seeking to expand access to healthy and affordable foods, and today I'm going to be talking mostly about small stores and some grocery work, but also is really very much focused on the community development and support for communities in need across a variety of different perspectives. So looking at access to health care, for example, physical activity, smoking, all of the modifiable risk factors for chronic disease. And our work, as many of us are involved with, really involves a lot more cross-sector partnerships than it may have maybe 5 years ago even. So just to show a couple of images here, with regard to small stores, we work in corner stores, urban corner stores, a typical example of which is on the left. So named, obviously, because they are on the corner of and a ubiquitous presence in many urban communities. But we also do a lot of work in rural stores, and they go by a lot of different names. So it may be a rural general store, it may be a rural grocery store, a small mom and pop. There's a lot of fuel retailers. Often they will combine fuel sales, convenience store, and an attached grill, for example. That's sort of a common combination, particularly in rural communities. And as I mentioned, the approaches to working with these stores have some commonalities, but they also vary fairly significantly. So I'm going to talk quickly through some of these things today in the hopes of getting to some good discussion as well. So here is a map of where we have worked recently in both urban, rural communities. Some of our work is really statewide and spans both rural and urban. But as you can see by the dots, if we were to plot a map of where the Food Trust was working or where really any of us were working, maybe 5 or 10 years ago, particularly as it related to corner store initiatives, it would really have been focused on the urban centers and the large urban centers at that. But over the years, many, many small towns, legacy cities, smaller cities have embraced healthy retail work in their existing stores. And I would say at this point, at least half, if not 3/4 of the work that we do nationally is focused on rural communities as well. So a lot of that work is taking place really from northern Maine, very far northern Maine, to northern California, to down in the Rio Grande Valley in Texas, and throughout the Deep South and even up into the Midwest and upper Midwest. So some program components with corner store work or small store work. Traditionally, and I sort of laugh saying the word traditionally because I think the oldest of these programs is maybe 10 years old, but historically the work really is focused around adding healthy foods to the stores. There is some equipment such as refrigerators or baskets or shelving that is added to the stores to help build their capacity to sell these new healthy items. There's some signage of varying types depending on which program you're working in and where you're working, but the idea is to help promote these new items in the store. And there's TA and training for the store owner to help build their capacity to sell healthier foods. For example, produce handling training or training around merchandising and displays. And that is, for a really long time, kind of where the work hung out. And none of these bubbles was easy to achieve, so a lot of work went into each of these. But today I find the work that we do and the work that many of our partners are doing, I'm sure many people on the call as well, has expanded quite a bit beyond this focus in the stores. So we have a real focus on the distribution and sourcing. Almost every corner store program or rural grocery program I work in now, it has a very intentional connection to local food, whether that's community gardens and urban agriculture or working with producers in the state or region. Incentive strategies, of course, are whether it's with Finney-funded incentives like Double Up Bucks or Philly Food Bucks, or whether it's just using coupons to promote the healthier items. We're doing a lot more work with replacement strategies, something that at first it was really, the focus was very much on adding, but now we're looking at ways that we can replace some of the less healthy items in the stores with healthier or health-neutral items. Education around health and disease prevention, screenings like blood pressure screenings, really getting to see what an asset these stores are in communities. On the sort of equipment side of things, we're investing in POS systems, ways of tracking sales. We do healthy checkout in stores of all sizes. That's something that, of course, was really created for more of a supermarket environment, but it's something that we've adapted to use in smaller stores. We do a lot of work on store layout and shelf placement and some of the more behavioral economics approaches to how people make choices and decisions about what they're buying. A lot more focus on the exterior of the store. So this is a store in our program now, and we did a new awning and nice new signage and painted it, and it pops in the community, and it's a point of pride in the community now. And then quite a bit with community engagement and connecting instead of us always providing the training, right? So that's great and an important thing to do, but it's also tough from a sustainability perspective. So what we try to do now is to provide sort of an intensive level of support in the beginning, but then with a real intention of having peer-to-peer networks established. I'm going to go really quickly through this piece because we could spend so much time just talking about the policies and the systems approaches to doing this work. This happens to be the city of Dallas, a place where we designed a robust healthy food retail initiative for a citywide program. So we've got zoning and ordinances and regulation. We're working with different sectors than we ever were before, really intentionally connecting, for example, to housing or the transportation sector, looking at the connection with other institutions, whether it's hospital or schools or food banks. And then I mentioned also a real intentionality around thinking about how the work that we do in grocery stores and in corner stores and in rural grocery stores connects to supporting a healthier regional food system. Just a couple of, I'll go pretty quickly through these slides. I didn't want to cut any of them out because I thought it would help with some discussion, but I also don't want to take up too much of the time. So healthy product introductions, still very much a part of what we do in corner stores, but more and more we are really very intentionally either partnering with WIC or selecting, using, looking at which stores are enrolled in WIC in some of the places where we work. There are either convenience stores that can be WIC authorized retailers, or we're working in a rural community where there's a rural grocery store, certainly supermarkets. We really prioritize working with those stores, which are already places where mothers can shop for food for themselves and their young children, and trying to make those the healthiest food and beverage environments that we can. The other thing that we do is we follow, we've gotten a lot more closely aligned in terms of helping the stores when we have a healthy product menu, which we work very hard to create and maintain. We just did a big update to it. We want to make sure that we're tying to WIC wherever possible. So for example, here's the whole grain row or food category from our product menu, and we've recently updated it to really reflect the WIC requirements for breakfast cereal. So we say, particularly when you're working in a small store, you're working in a store where distribution is a real challenge, the last thing we would want to do is to be encouraging stores to stock an item that doesn't help them maintain their WIC authorization. So we wouldn't want the store to have WIC breakfast cereals and then our breakfast cereals and then other breakfast cereals that they may stock based on shoppers' demand. So we want to be doing everything we can when we say it's a healthy item and we're doing in-store nutrition lessons about it being a healthy item. The last thing we'd want to be doing is conflicting with WIC, and actually what we want to be doing is helping that store do a good job as really a community arm of WIC. Here's healthy beverages. So we're at the moment having a wonderful internal conversation about, and somewhat external conversation about what this maximum should be on what's considered a healthy beverage. If it's juice, how big can that bottle be in order for us to feel good about it being stocked as a healthy beverage? We may go a little lower than this. It's very tough, but I wanted to highlight it just to point that out. But here we are really getting this concept of having healthy, larger size containers of juice because the stores need to stock that for their WIC minimum stocking requirements. And these, this is just an example of something that was never on our product menu before, just saying, it's got to be a 46-ounce bottle or can or larger of 100% juice in order to count as a healthy beverage. Healthy Checkout Initiative. We partnered with Center for Science in the Public Interest and Solano County Health Department in California and helped to design and implement a healthy checkout initiative in the convenience stores and small grocery stores. There were, I think, a supermarket or two in there as well in Solano County, which is outside of Sacramento. In-store marketing materials are really focusing on capitalizing on what's really a national trend in fresh, delicious, grab-and-go food. So wanting to make sure that when we are introducing new healthy items or we're helping a store change over its inventory, that we're making it sound appealing and look appealing to the customer. Here's some other examples of signage, both outside of the store. These are the window on the bottom left are window wraps. We've got banners, menu boards, and so on, focusing on healthy, fresh, delicious food. I always like to sort of get real and put in a little bit of a cautionary tale in some of my presentations, but this is a well-intentioned exterior that we did for Mini Market to Go, which is just a wonderful corner store in one of our programs in San Jose. And we went a little heavy on the cheese and bread. It was a little discussion, shall we say, with the designer about wanting to show cheese and milk and whole grain bread, in support of the store accepting WIC. But we obviously ended up a little on the wrong side of way too much cheese in this picture. And likewise, this I don't know whether anyone here feels the same way, but honestly, standing about in the street or crossing the street into the store, this looks like a hamburger, and you can tell maybe up close that it's slices of fresh fruit, but boy, it really doesn't look like that from afar. And then we, of course, did so much effort on the window sign that we forgot the store banner itself. So we've since gone back and tweaked that to be more appropriate. But I just wanted to show what it looks like when you're really excited about exterior signage and in the early days before we really sort of coordinated on making sure that the images popped. Here's some examples of other exteriors we've done with new signs and awnings. We did a community mural arts project in the one below to just make the exterior side of the corner store look beautiful. Gleaning and sourcing local produce is, as I mentioned, just becoming more an integral part of the work that we do. Gleaning, not so much, to be honest with you. That is something that we're still, we've just started. We're gleaning in there's about half a dozen stores that are getting gleaned produce. But definitely sourcing local produce is a really important part of the work that we're doing. And, merchandising it as such. So wanting to, subscribe to CAF in order to get the Buy Fresh, Buy Local materials. We have Know Your Farmer signage, really promoting that in the stores. We've also been doing hub and spoke distribution, where a larger grocery store or a high-performing corner store is really the distribution hub and then redistributes out to smaller stores in order to take advantage of the ability for that one store to meet the minimum weekly buying requirement that the other stores otherwise wouldn't have access to, and also therefore wouldn't have access to a wider variety of fresh produce and healthy staple foods. Healthy food incentives and coupons, I already mentioned, are really a growing and important part of the work we do. We do coupons called Heart Bucks at the end of our healthcare screenings that we do in stores. Of course, FINI, the USDA Food Insecurity Nutrition Incentive Program, supporting the use of incentive strategies to boost fruit and vegetable consumption by SNAP participants. Community engagement, so working with so many partners, community groups, and community members to do store launches, to do community events, do done-in-a-day type projects where you're painting or working on cleaning the store. It's really an important piece of the Corner Store program and also an important part of the sustainability of the initiative. Cooking demos and taste tests are also really popular and easy ways to promote the new healthy items in the store. I mentioned community clinical linkages, but here's just some pictures of our blood pressure screenings. We have a program called Heart Smarts, where we partner with FQHCs or local hospitals to have a health professional in the store doing blood pressure screenings or BMI assessments. I think there's a lot of potential here to expand beyond heart health, looking at type 2 diabetes, looking at opioid addiction, smoking cessation, which is we hand out smoking cessation kits and post information about quit lines in some of our corner stores, for example. And then finally, just to wrap up, just wanted to say, you know, all of these ideas and innovations are exciting, but I also wanted to bring it back down to earth a little bit and say that more often than not, particularly when we're working in rural areas, there may only be one store, maybe two stores to choose from, and sometimes they're not, you know, they're not ideal for one reason or another, or they're really challenging to work with. There's the infrastructure might not be there to really support distribution. And I just wanted to say that that's a very common challenge. And, you know, we and others have really identified strategies for working with a store like that and working with a community to work with the store to make those healthy changes, even when it frankly seems like everything would be working against you to bring about healthy change in that store. There's a lot of really wonderful strategies that we use. So with that, I'd be happy to answer any questions or just open it up for discussion as well.
Great, thank you, Karen. That was fabulous. I really like the hub and spoke slide. I'm not familiar with that model, but it really gets at some of the challenges I know we've been having with our Plan4Health folks around distribution and meeting those minimum requirements and not, you know, losing out on produce that isn't purchased. So that's a great way to approach that. As well as all of the other suggestions. That was a fabulous overview.
Thank you.
I do want to pause a moment and folks feel free to unmute your lines and talk with Karen directly, or if you have any questions or comments, chat them into the box on the right. Either would be fine. We'd love to hear from you and talk through some challenges or maybe what's been going well. And it looks like we do have a question from Angie. Karen, would you happen to have templates of shelf talkers you could share?
Sure, absolutely. So there's a variety of different types of program materials, and we make them as available as we can. I'd be more than happy to, you know, share some of the different examples of those with you. So yeah, absolutely. If there's a way that I could get Angie's contact information, maybe from you, Elizabeth, I'd be happy to follow up.
Oh, sure. And would folks be able to find some of those items on the Food Trust website, or is it easier just to kind of go through you?
I actually don't think they're on our website, but I do think they're on the Philadelphia Department of Public Health website. It probably also would be easier to go through me, so that if anyone needed to order them, we have a sort of mechanism for doing that with the designer of the materials. And there's also other examples of materials, like some of the grab-and-go type marketing material. So it probably would be easiest for me to send them.
Oh, sure. Okay. And Angie, I have your email address, so I will connect you with Karen this afternoon. That's great. All right. And then Elizabeth has a question, another Elizabeth. Could you speak a little more about the hub-and-spoke model? How do the smaller stores place their orders, and what do some of the other logistics look like?
Sure. And hi, Liz. Nice to talk with you. So that is a model that we have put in place in San Jose. We have a corner store there that has really introduced a kind of remarkable amount of healthy food, and the store owner is really engaged, learning a lot, and has transformed the store. So it's one of our flagship corner stores. And Jesus Santillan is the name of the corner store owner, and he has begun providing peer-to-peer support to 3 other corner stores in San Jose, in and around where his store is located. More recently, I want to say maybe 6 months ago or so, we created here. I'm actually going to go back to that. I think that will be easier to see. We created an order form for Laredo Market when he orders. When one of 2 things happens, either he goes up to San Francisco to the produce wholesaler, so there's a huge produce market in San Francisco, and he goes up with the produce orders from the other corner stores that he's distributing to, and brings back in his truck all of this produce. So it enables him to purchase in larger quantities and get a larger discount. But it also takes advantage of his membership in this wholesaler and frankly, his capacity to source the items and bring them back and redistribute them. He also now gets distribution from UNFI and a large broadline food distributor. And whereas another corner store nearby has a difficult time accessing some of the staple foods from their, I mean, honestly, and I don't think this will be a surprise to you, Liz, or others on the call, but some of the other corner stores are purchasing from retailers. So they're actually purchasing food retail at like a large supercenter or warehouse club, and then reselling that food in their store. So it obviously makes the prices higher, and it makes it more challenging to get some of these items in. Jesus now does a purchase of these larger quantities, breaks them down in the back of his store, and then delivers them to the other stores. One of the things we're currently looking at is whether having him do the deliveries, him or his wife do the deliveries, is more effective, or whether it's more effective for the other corner store owners to then actually go to his store and pick it up. That's kind of an aside. But anyway, certainly would be happy to talk to you offline, of course, Liz, if you want additional information about that. But that's kind of the high-level nuts and bolts of how it's working.
Thank you. That's interesting.
All right. And then I'm looking at, should I go to the next one, Elizabeth?
Sure, go ahead.
Okay. So I see Aaron asked, in Boise, they're just starting to build relationships with local corner stores to bring in healthy foods. Do you find that most stores were accepting of the transition or addition of more healthy foods? So I would say yes, but we have found that it's really, really helpful to have a compelling narrative and to have great recruitment materials. So to have, before and after photos that really pop to really show examples of equipment in place in stores, to talk about what the program can do for the store. So I don't, we definitely don't approach it with store owners. I think this also maybe, this gets a little bit at Erin, actually there was another question I saw down below about rural strategies. I'll talk about that in a second. But we definitely don't ask the store owner to be trying to be, a public health professional or a dietitian. We really are trying to make the case that it is important for their business. And so we have, we find that anecdotes and quotes from other store owners are really, really helpful. We provide before and after photos as much as we can to really talk through what it is that we're going to be providing, but also what it is that we would ask them to be doing. And I'm always happy to, have a further conversation about that. But yeah, I mean, if we wouldn't, if the store owner were not accepting of adding more healthy foods, we wouldn't be doing it. Okay, Laura said she'd love to see examples of the materials. Certainly happy to share that more broadly. Okay, so Meryl asked, how do you get the small rural stores to buy into this? That's a really great question, and I think we do tend to focus on a couple of things. So one is the small business owner part of things. So really helping the small business owner make their business a more successful business. We certainly focus on the bottom line aspects of that. We also talk about providing, kind of what we're doing in terms of any relationships with distributors that they might be able to take advantage of, discounts on equipment, free energy audits, whatever it is that we're bringing to the table. And then we also talk a lot about trends and national trends, and they're really well aware of that. I mean, there's very, few business owners who aren't aware of what the, other kind of larger chain stores are doing, what the grocery stores and supermarkets are doing with regard to fresh, with regard to grab and go, different types of beverages, like the juice waters and the flavored seltzers and so on. So we do really try to talk about that from that perspective, and also just talk about, acknowledging that the grocery store in any community, frankly, but particularly, Main Street America or rural communities is the business anchor of the town, almost without a doubt, and that, strengthening the role of that store and their kind of business prospect to really help support the town, and really understanding that they are kind of the hub and anchor of the community that they're living in. Do we have different strategies, Marla's asking, of marketing and outreach in pedestrian-friendly areas versus car-oriented? Really great question, and the answer is definitely. So we look at different types of stores. We look at stores that are used for fill-in trips for groceries, and we look at, and that could be a rural grocery store, it could be a corner store. But those stores and there's sort of different ways that we can tell that store is being used to purchase groceries. They may not be healthy, but people are using that store to fill in between larger big shops at a more distant supermarket. Versus a store that is only used to purchase cigarettes, alcohol, gas and snacks, maybe a hot dog on a hot dog roller, on the way out the door. And we can very much tell the difference between those types of stores. And there's a couple of other types of stores, but at a high level, the difference between sort of a pure convenience store where everything that is sold in that store is being consumed very quickly upon, right after purchase, either immediately or shortly after purchase, versus a store that sells eggs and milk and has some fresh produce, and maybe it's only onions and peppers or potatoes right now, but people are clearly, touching base and going into that store to get those items. So those are different. I would also say, and could talk quite at length about this and would be really happy to, the work of a corner store program. So looking at, for example, the city of San Jose or the city of Dallas, and what a corner store strategy looks like in a city that is that spread out, where the urban centers of that city might have much lower population density, where there's large highways that make it very difficult to get to that store. So in terms of the walkability, we work on selecting stores a little bit differently. We prioritize a little bit going deeper within maybe one or two communities before spreading out too much. For example, in New York, in Philadelphia, in cities that are more walkable, we are able to capitalize more on foot traffic, do more sort of outdoor community events. I could probably talk, I probably talked long enough about this, but I could talk quite at length about kind of how to, and it's sort of one of the big things that we do, right, is figuring out how do you get the right initiative in the right place. Great.
That's great. That was a great question, Marla, and a fabulous answer, Karen. I think that's important
Sure.
from the planning perspective, to recognize density and to really think strategically about not just the store itself, but really where we are.
And I just wanted to quickly answer Gail's great question about experience with cities or counties working on higher tax on sugar-sweetened beverages. Yes, we're in Philadelphia and passed a tax on sugar-sweetened beverages a few months ago, and have already, our corner store program had been going on for years prior to that, but with the advent of the sugar-sweetened beverage tax, it is changing how we are working with stores on beverages and making sure that the stores are going to be able to really merchandise and effectively source healthier beverage items. I showed you briefly our product menu. We just revamped that really in order to support things like Rethink Your Drink in stores and drink up campaigns and things like that in our corner stores.
Great. Well, thank you, Karen. This has been a fabulous discussion. Thank you for all of you who are on the line and stuck with us beyond our 30-minute mark. This was really, really wonderful. Lots of great resources and ideas. If you wouldn't mind, maybe, Karen, just scrolling back to that last slide with your email address. And if folks have other questions, I'm also happy to connect you with Karen or with other resources within Plan4Health. And my email address is in the chat box as well, ehartig@planning.org. And we will post a recording of this call on the Plan4Health website. And thank you again, Karen, for taking the time to share your expertise. This was really wonderful.
Thank you so much, Elizabeth, and it's been nice talking with everyone. Happy to help and follow up anytime afterwards.
Great. Thank you so much. Have a wonderful afternoon, everyone.
Bye.